Well, the Senate has so far allotted 18 billion pesos in next year's budget for this vaccine rollout. But with the additional cost mounting for the storage and distribution, will this be enough? Let's hear the take of Senator Sherwin Gatchalian. Senator, thank you so much for joining us on The Final Word. First of all, does this 18 billion already include not only the vaccine, but all the other logistics from the flights coming to the Philippines, the cold storage facilities, and the distribution?
The vaccine, in our discussion during the budget deliberation, the 18 billion is only for the purchase of the vaccine. And to be honest about it, Rico, the details of the vaccine is a moving target. We're hearing costs of about 2,500 pesos per dose. Now there's a cost of about 500 to 600 pesos per dose. So it's actually a moving target. So what happened is when the budget was submitted to the Senate, we allocated an amount, 18 billion pesos, to make sure that we can buy the vaccines right away, because it's important to have that in the budget so that when the vaccines come out soon, we have something to draw upon. It doesn't include the logistics,
right?
But because we have experience in distributing different vaccines from polio to dengue, we have the infrastructure ready in place. Although I have to admit also that this COVID-19 vaccine might be different in terms of requirements.
Yeah.
So that's
really
again
it could really be quite different.
Yes, that's something
Senator
again we need to build on.
Yeah, because some of the vaccines will require cold storage facilities of -20 to -70.
Correct. That's why in terms of vaccine experience, we have that, no? Because we've been conducting polio vaccines and other vaccinations for a very long time already. But since the details are now coming out in terms of the technical requirements, government can still draw from its other funds to make sure that we can roll out the vaccines nationwide. IRTM has the facilities for sure, meaning if the vaccines come here, they can keep it in IRTM, but we need to build infrastructure in place to distribute it nationwide, because apparently the details that we are getting is the handling and the storage of this vaccine is quite different from the ones we have. But rest assured, we have the funds, because number one, Bayanihan 2 gives the power to the president to realign funds. And there are other sources also inside the 2021 budgets wherein the DOH can use and tap to build infrastructure.
Do you believe, Senator, that the government can do this on its own? Or does it really need the help of the private sector, which has already committed to buying 2 million doses?
First of all, Rico, it's important that we target first the most important people. Now, for example, the frontliners. It's important that our frontliners are vaccinated so that when anything happens, we have the frontliners to take care of our constituents. Then second, we have to make sure that the poorest of the poor gets vaccinated also, because we don't want our poor constituents to be left behind. Frankly speaking, those who can afford will probably buy it ahead of everyone. I'm pretty sure that the private hospital, private medical distribution companies will bring it in ahead of everyone. And those who can afford it can buy it. So what we need to address first are the frontliners and also the most vulnerable. And with that universe, government can afford to pay for the vaccines and give it to them.
So from your assessment, Senator Gatchalian, how long will it take to vaccinate the whole 110 million Filipinos? Some say between 3 to 5 years. Will it really take that long?
Well, in my opinion, we have to vaccinate as quick as possible. Number one, Rico, the economy is taking a hit because not everyone can go to work, and we're not producing at full capacity, meaning our economy is not revving up to its full capacity because for obvious reasons. Some people are afraid to go out and the confidence are not there. So in a perfect setting, we need to vaccinate everyone as soon as possible. But of course, there are constraints involved, like for example, logistics, training. We don't even know if this vaccination can be conducted by our own expert, or does it need special experts or special equipment. So these are the details that are quite hazy right now. But in my reading and in my discussion with experts, we might need the whole of 2021 to at least hit the 60 million adults or 60 million people who are in our workforce.
Thank you so much for joining us on The Final Word, Senator Sherwin Gatchalian.